Hello, beautiful people. So today I would like to enlighten us on how to use our toothbrush properly. Um, I know a lot of us have been using our toothbrush for quite some time. Let me see, almost the whole of your life. But most of the times we do it wrongly. So today I would like you to have some take home. Um, I would like you to have some take home of how and so that you can be able to do it, practice it. It's a gradual process. I know it's going to be another adjustment, but you can do it, and then you can teach your children who are coming up. All right. So most of the times, people go to the market and purchase any type of brush they want, which is not which is not the way it's supposed to be. All right. So sometimes when you go to the market, there are different type of brush. We have like three type of brush. I mean the bristles. Okay. All right. The bristles. Some are hard, some are medium, while some are soft. So mostly the soft ones are produced in the smaller size, that's the children's brush, right? While the bigger ones comes in mediums or hard toothbrush. So we recommend the medium toothbrush for any normal and healthy person. Most of the times, hard toothbrush are made for dentures. If you have a denture in your mouth while you're brushing, you remove it out, and then you can use your hard toothbrush to brush out your denture. Please don't use hard toothbrush in your mouth. It's not good. All right. So um, today we would like to see how you use the brush. So I bet a lot of us grew up, or let me say, I used to brushing our teeth like when you put on your toothpaste on your toothbrush, and then you just maybe rinse your mouth, and then you just start brushing all over, brushing everywhere. You just open. Some of them will just do it like you guys are fighting, while it's actually not um, proper. All right. So when you're going to brush, a lot of us close our mouth. Do not clench your teeth like this. The way I have this. Let's say, for example, this is your mouth. All right. So this is my mouth. So you don't clench your mouth while brushing. And brushing is not something that you do it in a haste. You need to take your time to brush. So before I continue, I would like to give us a head up as to how many times you need to brush in a day. All right. Normally, you're supposed to brush 2 times in a day. One, the last thing before going to bed. After you must have ate everything, your shawarma, your pizza, whatever it is that you want to eat, make sure you're done eating before you do your brush. That's the last thing before you go to bed. You brush, you do your prayers and go to bed, or you pray, you brush, then you sleep. Alright? So when you're brushing, okay, you brush last thing in the night. In the morning, you don't need to brush again because you're not brushing. What are you brushing again? Alright? Most people take brushing as a tradition. They do not understand the concept or the idea behind the brushing itself. Brushing simply is the taking out all of those things that you've ate that got stuck in your mouth because you ate it through your mouth actually. So those things that you ate that stuck on your teeth, you're trying to remove them. That's why the bristles are designed in such a way that you can be able to remove them effectively. All right. So um, when you brush at night, then in the morning, when you wake up, yes, you've slept for quite a long time. Your mouth is closed. So what you're supposed to do is to just gargle your mouth or rinse your mouth out. All right. When you must have taken your breakfast, get ready to work or wherever you want to go, then you brush again. Why? Because most times if you go out there, you're going to have a long day, and then you're not expected to go to work with, let me say, the breakfast you ate stuck all over your teeth. All right, so you need to take them off because you're going to have a long day. So we don't expect those food remnants you ate to still be on your tooth or on your teeth. So you need to brush it out. When you go to work, someone will ask, if I go to work and I eat maybe lunch, do I need to brush again? No. You just need to rinse your mouth, continue eating your eating, so that in the night you come and brush out. Alright? So when you're going to brush, since you're doing just 2 times a day, take your time. Take your time. Do not clench your teeth. Open your mouth. You're supposed to open your mouth. You don't close your mouth while brushing. Because when you close your mouth, let me tell you why you don't need to close you're not supposed to close your mouth while brushing. When you close your mouth, and you'll be doing like this, you'll be doing like this, you'll be doing like this, you'll be doing like this. What you're doing exactly is this one enter here, this one come out, enter here, this one I ate, enter here, this small pizza enter here. That's what you're trying to do. You're supposed to brush the upper part separately and the lower part separately. Alright? So when you're brushing, you start, anyone you start with, either the upper part or the lower part, but I advise you to start with the upper part. Since the dates are coming down, then you finish with the lower part. Alright? So when you're brushing your teeth, then open your mouth, do not close it, do not clench it, brush the upper part separately. So that's why, okay, another point I wanted to make emphasis on why when you brush like this and like this, it affects your tooth. Most people come to the dental clinic complaining of having pains here, having pains here. So when you ask them, do you think there's a hole on your tooth, or with your mirror, were you able to see anything like a hole on your tooth? And they'll be like, no, I don't think I have a hole on my tooth, but those places, those molars are paining me. This is as a result of the improper brushing we're doing. Alright? So that's why you need to take this brushing advice seriously. Alright? So when you open your mouth, you brush up separately, you brush down separately. Alright? So if you're brushing the back, okay, you just give it a small motion, then you bring it down. You just a small motion, you bring it down. While you're doing it, yes, it will touch the gum while helping to massage the gum. And when you do it, when you bring it down, it brings the dirt that you've tried to. It's just like sweeping your room. Okay, you don't sweep your room anyhow. Dirt will enter under your couch and other things, your wardrobe and stuff. So you don't sweep anyhow. You have to do it in one direction, and in direction that you know that you'll be able to pack the dirt at the end of the day. So that's why by the time you do the small motion, then you bring it down. Alright? You do it, you bring it down. You do the same for this side. Then you do it, you bring it down. You do like 5 strokes or each on each quadrant, that's each side. This one's are the molars, and this one is the front one. You do it small, you bring it down, small. When it goes to inside, make sure this one on the front, you're going to bring it out. Alright? You're going to bring it out. This one on the front, you're going to bring it out. And the same goes for the molars inside. You do the same, you bring it down. 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 You see how I hold my toothbrush? So I was able to turn it because it's designed in such a way that it can accommodate any part of your mouth. Alright? When you do, you finish, you spit it out. You do the same for the down part. Alright? When you do from inside, make sure that this brush enters under your tongue to brush this side. Alright? Then you do like this, you bring it up. You do like this, you bring it up. This one is for the down parts. This one is for the down parts. In fact, a lot of us don't brush here. They don't brush here, the inner and because when you do like this, when you do like this, you open your mouth. You know, up is easier to do it fast. Then you just spit out, and you forget to brush here. I bet you most patients came to the clinic. This very place accumulates a lot of dirt, This place accumulates a lot of dirt. So this place, give attention to it. Alright? Then brush out. If it's in my mouth, I brush it out. That's the front part. But the inside, I'll do it and bring it up. Alright? While my mouth is open. When you finish, you brush your tongue out, then brush your palate out too, and then you're done. Approximately, you brush for like 15 minutes. This is good for you. So you take your time and do it. And so another disadvantage of brushing, let me say, in the normal way we know how to brush, like this and like this. While you were doing like this, aside from end up having like gingivitis or pockets or any other thing, you end up injuring your gums. If you see elderly people, maybe for example you're able to see their teeth, and the disadvantage of brushing that way can cause abrasion, which at the end of the day or after some years you realize that the teeth here is wearing away, their roots is getting exposed as a result of the methods they use in brushing their teeth. So thank you guys for watching. Let's do this next time. All right, thank you.